Hello, my name is Dr. Ezekiel Oburo. I am an orthopedic surgeon here at Nairobi Spine and Orthopedic Center, and today I would like to talk about one of the common problems that afflicts patients that we see in orthopedics, and that's osteoarthritis. So osteoarthritis, probably we'll start with the hip first, is a condition in which the cartilage in the hip or in any joint is worn out, and the cartilage is what allows the smooth gliding of the bones in the joint, and therefore you're able to walk, able to do a number of movements, and able to be relatively pain-free when you walk. Now, when you have osteoarthritis, what happens is the cartilage gets worn off, and at the end of the day, the bone starts rubbing on the other bone, that is the bone of the pelvis, starts rubbing on the bone of the femur, which are the two bones that make the hip joint, and you get a lot of pain. So, what do you do when you have osteoarthritis of the hip? One of the things that you could do is you could start with painkillers, and the painkillers will help with regards to alleviation of pain. The other things that you can actually do even before that is to lose some weight. So when you lose weight, it really does slow the progress of osteoarthritis. One problem though sometimes is that there are people who are relatively lean and they still get osteoarthritis, so there are other components that are associated with osteoarthritis. One of the issues really sometimes is even genetics or previous injury of the hip in that area. Now, when you've exhausted all non-operative options, then the operative option that is left really is a hip replacement. A hip replacement is one of the best operative procedures that has ever been invented, not just with regards to orthopedics, but with regards to other things. It is one of the most successful operations. Some people have even said it is only second to cataract with regards to patient satisfaction. So what does a hip replacement involve? A hip replacement involves replacement of two components of the bones involved in the hip joint. Now you have the acetabular component and you have the femoral component. This is the acetabular component, and this is what you're going to use to replace the one cartilage in the socket of the hip joint. As you can see, it's made of plastic. The plastic is also known as polyethylene. Now, this is what is known as the femoral component. You can see there is a stem, and there is a neck, and there is a head. Now, when you do a hip replacement, when you remove the cartilage, you will put this as the socket, and you'll put this as a stem, and then the head and the stem, and then this will articulate like this. So there'll be a gliding movement in which the head fits into the socket, and that is what the patient will be left with. The pain relief after hip replacement is almost immediate. In fact, the patient will start walking almost immediately the next day. Some places the patient may even walk on the same day. And how long does a hip last? That's what the patients will ask. A hip may last up to a period of even 10 or 20 years. You would find that 90% of the hips that have been put are lasting 10 years, and even up to 80% of the hips that have been put are lasting 20 years. Now, what is the good age for this? This is what people ask. And I usually tell my patients that patients who are in their 60s or 70s really are in the ideal age for this. But we don't just look at chronological age, we look also at physiological age. The patients who are 80 and really are fit for a hip replacement. So, thank you very much.